My name is Angie Robinson, and this is my presentation. Suicide is an increasing problem among teens. It is now the third leading cause of death in children ages 13 to 19 years old. There are many different reasons why teens commit suicide, and many can be prevented. Teens commit suicide for many different reasons. Many feel stressed, confused, or pressured to succeed. Others may be trying to cope with parents, divorce, or remarriage. Remarriage causes many new stresses, like step parents and step siblings. It may even cause the family to relocate to a new town with new friends at a new school. Many teens commit suicide because they don't know how to deal with their problems. They will eventually become disconnected from family and friends. This is the time when they need somebody the most and when they may be thinking about ending their lives. Where many teens are involved in extracurricular activities or have a large support group of friends and family to help them deal with their problems. Other factors that increase risk of suicide among teens are psychological disorders, feelings of distress, irritability, or agitation, previous suicide attempts, family histories of depression or suicide, physical or sexual abuse, lack of support, or dealing with homosexuality in an unsupportive family. One of the biggest reasons teen suicide rates have increased is because teens have more access to firearms in the homes. Nearly 60% of all suicides in the United States are committed with a gun. Some studies have also shown that even if guns are properly locked up, teens are still 4 to 10 times more likely to commit suicide from a gun in a home than without guns in the homes. It is okay to keep a gun in the home, but they need to be stored properly. They should be kept unloaded in a locked cabinet with ammunition stored in a different locked cabinet and the keys in an unknown place from the child. Warning signs for suicide can be hard to detect. Parents also need to watch for signs of depression. Children that are severely depressed can easily turn to suicide. Some things to watch for are changes in activities and emotion, getting into trouble, confusion about sexual feelings and identity, changes in behaviors or pattern, and the use of drugs or alcohol. There are also many teens that just keep to themselves and parents don't have any signs to watch for. If the child makes any comments about hurting themselves or thinking about hurting themselves, parents need to take them very seriously. This may be the child's only way for asking for help. Suicide is often triggered by small everyday events like getting into trouble, arguing with a parent, boyfriend, or girlfriend, getting a bad grade on a test, or not making the team. If you think your child is unhappy about something, try asking as many questions as you can to get them to open up and tell you what's going on. Having an open relationship with your child may make them feel more comfortable about talking to you. If a parent learns that their child is thinking about suicide, you need to get them help immediately. Even if the child states that they weren't actually going to do anything, you should still have them evaluated. This can be done by making an appointment with a psychologist or a psychiatrist. If you think it is more serious, you should take the child to the emergency room. If your child states that they are doing better, they still need to go to their appointments because suicidal thoughts can come and go. If you still have questions and don't know who to talk to, there is a National Suicide Prevention Lifeline at 1-800-273-TALK. They are available 24 hours a day, 7 days a week. If you're unsure if your child needs help, get it for them anyways. It's better to get them help even when it is not necessary. Teen suicide isn't 100% preventable, but the rising rates can be slowed if parents stay involved in their child's lives. If you think there's a problem, intervene as soon as possible. It is better to help stop something before it is too late to get them help.